vision of the Promise Fund is to end deaths from late-stage breast and cervical cancer. And right now there are over 80,000 women who have no screening, no regular screening, and no medical home. And we have provided them with first ever mammography equipment, Hologic 3D Genius machine, so that no one has to go in our county without a mammogram. And what's unique about the Promise Fund, this particular program, is it is a confirmed partnership with our federally qualified healthcare center called Found Care, which has a large amount of patients, maybe 20,000 patients a year, men, women, children, but who can make this kind of screening accessible, affordable, and regular the way it should be.
Last year we served over 18,000 individuals for about 114,000 visits. I can tell you that we were the first to provide COVID testing. We are now going to be the first to provide this type of service in every FQHC in the nation, and it's because of the Promise Fund.
I've been in cancer surgery for 40 years, and what's very, very clear is that early detection leads to cure. And so having a center like this in our county allows us to hopefully prevent patients from dying of this terrible disease. Our institution, the Miami Cancer Institute, is now one of Promise Fund's biggest sponsors because we think what she has done and what she is doing can change the care for the most vulnerable patients in the world that we have right here in Palm Beach County, and we're here to support her.
Well, I am a breast cancer surgeon, so this is very personal to me. This is what I do day in and day out. This is what I've devoted my life to. So I see patients all the time who either don't have access to care or maybe do have access to care, but we're unaware of the screening recommendations to get their mammogram every year. For patients who are either unable to due to transportation reasons or due to insurance reasons, that's really the focus of this project, to be able to catch those patients that are really at risk. And it is so important to bring a project like this to Palm Beach County.
So I do have a personal connection. So aside from the fact that I treat breast cancers, this is a disease that has affected my family. I am a first-generation immigrant. We moved to the U.S. when I was about 10 years old with a single mother and my aunt. And it was a community similar to what we're seeing here that helped us. So to me, it's an amazing opportunity to give back, to give back some of what people have given me and my family over the years. So it's a very special commitment to this.
I was asked to talk a little bit about Hologic, and exactly what Nancy said is so true. Growing up in a poor community, I expected a hand-me-down machine. I expected that we'd have to clean it down, maybe something rebuilt. They gave us not only a brand new machine, they gave us the top-of-the-line machine that not hundreds but thousands of women for generations to come will be saved because of this initiative today. Women are the cornerstone of our community. I lost my father when I was 20 years old, and thank God I am still here. Had I lost my mother, the story wouldn't have been the same because I wouldn't be able to make it. So in our community, the mother, the woman, is everything. And so we're very lucky and very blessed to be here today.
And we have the support of our community because they know the problem that we're all facing here. These are our neighbors, people without care, because of our fragmented healthcare system. Because really, in our community, we have mostly for-profit hospitals, which make it impossible for some people to come for any kind of preventive study or care. So we know we have to fix it. It's our community, these are our neighbors, and we want to keep our community being one of the best in the world.
Not too long ago, I was the woman that needed care. I had no insurance. I was working. I had no way of obtaining the screening that I needed in order to save my life. I didn't qualify because my income was just a little bit too high. I had no children. I wasn't blind, and I wasn't disabled. So that left me in the middle of nowhere. I had no family. I had no support. So I had nobody to run to. And when I did run to the places that were in place, none of them were able to say, we can help you. Knowing that I had cancer was not the worst news. The worst news was knowing that I had it and I could not be treated for it. That was the nightmare. And I'm so grateful to the Promise Fund of Florida, not only for the machine, not only for this location, but for the opportunity to meet a woman, have it before me, and be able to say, we can help. No matter whether you have insurance or not, no matter if you speak the language or not, no matter if you have transportation or not, no matter if you can bring your kids with you or not, we can help you. And we heard it today. If you save a life, you have the opportunity to save the world. Somebody saved mine.
Insured women in Palm Beach County and those who lack medical resources is something in the order of 90,000 women, and I think we can make a difference. It brings me a great deal of satisfaction in knowing that we can positively affect lives, and in a meaningful way, we can use our time and our energy and our resources to help the world.
I made a promise to my sister 45 years ago when she developed breast cancer, and she was very young and subsequently died a few years later because she didn't have access to screening or care or the right kind of care, because there wasn't any care at that time in the United States. And I promised her, she asked me if I would cure breast cancer. I don't think I've gotten that far, but I was able to found the Susan G. Komen organization and ran it and was part of it for 35 years. But I realized that what was missing was this great piece, the growing disparities in the United States, including our county. And when you see them and you realize how it really just takes concerned citizens to fix them, you say to yourself, we can do better than that.
This particular cause matters because really breast and cervical cancer can be eliminated. Deaths, at least deaths from those diseases, and it's in our grasp. And so we have an opportunity here if we apply the knowledge that we have and the energy that we have to eliminate deaths from these two diseases. And particularly right now, with COVID sort of overshadowing everything, a lot of preventative stuff is getting pushed to the side. And so it's important to keep up the emphasis on preventing end-stage deaths.
Well, what we hope is that people who come into Found Care seeking help, which they do every day because they're a wonderful primary health care center, and now they're adding dentistry and child care, etc. We hope that women come knowing that they can get a mammogram and get some kind of answer. Do they need further diagnostic work? What do they need? And then they become part of a continuum of care.
I believe that from the efforts of the Promise Fund and our partners, there will come a day when no woman in Palm Beach County will die of these cancers. And then there will come a day when our model will be adopted by other cities, transforming neighborhoods across the country. Your support up until this moment has made our dream a reality. You are the reason the Promise Fund has succeeded in opening a mammography screening center and in supporting nearly 5,000 women throughout 2020. Please join us in continuing the fight. Together, we can keep our promise to end late-stage death from breast and cervical cancer in Palm Beach County. Thank you very much.